inviting me to. Thank you so much for that introduction, Caroline, and for the opportunity to talk to all of you today about respite care. For those of you who are not familiar with ARCH, we are a federally funded national training and technical assistance center. Our services are available at no charge to anyone who needs information or assistance about respite or caregiver support. At the end of my presentation today, I hope you'll have a few important takeaways, getting more information about respite, finding out exactly what it is and how it can help you and your family. How do you find and pay for respite? How do you make respite work so that you get the most out of your very valuable respite time? And then, as Caroline was talking earlier about disaster preparedness, I was asked to share a few resources that could help around caregiving issues when there is an arising emergency or a natural disaster. Well, let's start with the definition. Um, what you see on the screen is the official definition of respite from the Federal Lifespan Respite Care Program. And that's a federal program that helps states build coordinated systems of respite care. They help families pay for respite and find respite and use respite. Um, and that definition is planned or emergency care provided to a child or adult with special needs in order to provide temporary relief to family caregivers who are caring for that child or adult. So while the respite itself is care provided to the person in care, the benefit is really meant to be for the family caregiver and the family. Um, During COVID, we became a lot more flexible about the respite definition and certainly more person and family centered. And now when we talk about respite, we're also talking about informal services and supports that can relieve or reduce a family caregiver's responsibilities for care and provide that much needed break. For example, respite might be in the form of virtual support groups like this one, participating in community activities, having someone assist with household chores, just about anything that the family says would give them a break can be considered respite. So simply put, respite is a chance for you to take a much needed break from your ongoing caregiving responsibilities. So many family caregivers don't know what respite is, though, or that it might be something they need or could benefit from, or they really don't feel comfortable asking for it or how to ask for it. But everybody needs respite. Respite ranks as a top need among all family caregivers, regardless of the age or the condition of the person for whom care is being provided. And most of us who are family caregivers, we do this because we love our child or our family member or a close friend that we're providing care for, and we want to provide the best care and support possible. Caregiving has even been documented to demonstrate that it can bring a caregiver great emotional and spiritual satisfaction. But we also know that continuous caregiving can take its toll. By providing at least some time off, respite can help reduce your stress. And we know now that reducing stress is central to helping improve both your physical and emotional health. And we've heard a lot of talk in recent years about the health detriment specifically of social isolation. And respite can help us reconnect with our friends, family, our community. And again, this is very important to our well-being. So in short, respite really helps make us better caregivers. And our children benefit too from time away from us to spend with other kids or doing fun activities, just being a kid. Uh, Despite all these benefits, we know it can really be hard to ask for help. We worry about our children while they're in someone else's care. Again, perhaps we don't even know where to go or who to ask for help. The first thing to know is that there are all types of respite available. It's not one single thing. There are formal services that provide in-home or out-of-home care. Out-of-home care may be provided by home care agencies or specialized child care centers. Community and faith-based organizations may offer center-based care close by in your neighborhood or in your house of worship. There are disability organizations like United Cerebral Palsy or the ARC or Easter Seals that may actually provide direct services. And while there are still too few, and I heard Caroline mention this earlier in her announcements, there are a growing number of children's respite homes that provide overnight respite in a pediatric palliative care center. And she also mentioned that Jonathan Cotter, who founded Children's Respite Homes of America, is going to be speaking with you in March, and I'm really excited about that. He's a good friend of mine. He's wonderful, and he'll be sharing a lot more about how these programs work and what he's doing to help expand their reach nationally. Other out-of-home types of respite might be provided in a children's hospital or specialty hospital that has set aside respite beds. And then there are informal services that might be provided by your family and friends. There are some programs, parent cooperatives, where parents share respite opportunities. Again, volunteer or faith-based programs. One very promising model that's growing, especially among our Lifespan Respite Network, involves partnerships between community-based agencies and universities and community colleges, using nursing or social work students to provide respite for children at home or in center-based settings. And we have some wonderful models that we work with in Massachusetts, Rhode Island, and Virginia. And one of our goals is to help replicate these types of services nationally. Of course, the next big question is, how do we pay for respite, even if we can find it? Family caregivers tell us a big barrier is the cost of care, especially if your child or your grandchild doesn't qualify for public funding. But here are a few public funding sources that you may not be aware of, as well as I'm also going to share some sources from the private sector. In terms of public funding, without a medical diagnosis, it might be very difficult, if not impossible, to meet eligibility requirements for some of these programs. Others have more flexible definitions of disability or chronic illness, and it's possible to access funding through them. Medicaid home and community-based waivers, as you probably know, are the largest source of federal funding for respite, but as you also may know, there may be long waiting lists for services. Or accessing because of eligibility restrictions can be very difficult to navigate. And you can find more detailed information about eligibility and the type of respite that's provided by each Medicaid waiver on the ARCH website. And I'll be putting links to things that I'm referring to in the chat when I'm done. Another program that perhaps you haven't thought of is the Family Caregiver Support Program. It is administered in every state through your local area agency on aging. But the agency name is sometimes misleading and off-putting to parents of children or grandparents, but they may be eligible for services. In addition to respite for older adults, the program also supports older parents who are 55 and older who are caring for an adult child with a disability, or grandparents or other relatives who are raising grandchildren under the age of 18. So if you fall into either of those two categories, you still may qualify for respite under that program. And I'm sure this is a program most of you are familiar with, the Title V program, specifically the Children with Special Health Care Needs program. It's a block grant to states. That means states have a fair amount of discretion in how they spend these funds. There are really only a handful of states that currently use or have used these funds in the past to pay for respite. including Arkansas, Arizona, Connecticut, Mississippi, Vermont, Washington, but it's still worth checking to see if your state might provide some respite assistance through this block grant. There are also a number of states that support respite through state funding. The Lanterman Act in California, here in California, I know many of you are from California, authorizes state funding for respite. Massachusetts funds respite in its state-funded pediatric palliative care program. Again, so there are other states as well. For everybody else who happens to be lucky enough to live in a state with a lifespan respite care program, and not every state has one because it's a competitive grant program, but it is a federal grant program to states that helps states build these statewide coordinated systems of care, as I said earlier. It also helps families pay for respite. Many of these grantee programs are currently providing vouchers or stipends to help families pay for any care they choose, especially families who don't qualify for other public funding. So lifespan respite very often fills the role of being gap filling and serving those families who aren't getting help anywhere else. These programs are also wonderful in terms of building capacity in that they also support the startup of volunteer and faith-based respite services and may even help be very involved in the recruiting and training of respite care workers. And we know that's a very big issue. I mean, even if you have the funding to pay for respite, you often can't find the provider. There are some private sources of respite funding as well. Again, it's really worth checking with your local or state affiliate of various disability organizations like Easter Seals or United Cerebral Palsy. There may also be freestanding community-based respite programs for children that offer services on a sliding fee scale. Arch or at no cost. Arch has identified some of these programs. We have an initiative called Innovative and Exemplary Respite Services, where we put out a national call every year to find services that meet our criteria. And we have information about these on our website. It might be hard to find them anywhere else, so you might want to take a look at that. And then I also heard Caroline mention NORD earlier, the National Organization for Rare Diseases. They also offer a respite grant to families, and you can find information about that on the link on this slide. And again, I'll put that in the chat in a minute. Where do you find respite care? There are some important resources that can help you find respite providers, as well as identify ways to pay for them and how to access all of that. If your state has a state respite coalition, and usually those state respite coalitions work in conjunction with a state lifespan respite care program, and you can start there. They can help you navigate all that's available in the state related to respite, or they can connect you to your state's Aging and Disability Resource Center or No Wrong Door system. These ADRC No Wrong Door systems, they might be called something different in every state, but they are designed to help you navigate long-term services and supports for people of any age or condition. You can also identify your Aging and Disability Resource Center. Again, the name is misleading, but the Elder Care Locator Service. And I didn't put that on this slide, but I can add it in the chat. Can connect you to your ADRC in your state. If you don't have a state respite coalition, you might want to take a look at the ARCH National Respite Locator Service. We maintain that on our website. Children's Respite Homes of America that I mentioned earlier, that Jonathan Cotter is the founder of. It is an association that has a list of pediatric palliative care homes on their website. And I put the link to that here. And then again, it's always worth reaching out to your local disability organizations that I mentioned on the last slide. But even if they don't provide respite or help pay for it, they most likely can connect you to other local support groups, parent groups, or caregiver groups, just like this one. And sometimes we found the word of mouth is really the best way to find respite services that you can feel comfortable with. One parent-led organization that can be particularly helpful for children with medical complexity, and I'm sure many of you are familiar with these organizations as well, is Family Voices. Family Voices has a state affiliate in, I believe, every state. They also often house the federally funded Family to Family Health Information Centers that can help you navigate a host of services in your state, including respite. Again, this website link on the slide can connect you to both your state Family Voices affiliate and your state Family to Family Health Information Center. Well, now that you have found respite and you have some idea of how you might pay for it, it's really important to start planning for it right away. We know that respite is most helpful if you're able to use it early when you first become a caregiver and use it as regularly as possible. How frequently you use respite is very important and can determine how beneficial the respite will be. But so many of us, so many parents, we wait until we're in a crisis to seek help, and it's really much better not to wait. Of course, everything that I just mentioned, we know that this requires readily available resources and access to information about respite, but it also requires a bit of planning to make the most of very limited respite time. And good planning can even help maximize the amount of respite that's available. If you're fortunate enough to have planned respite, take advantage of it and plan what you will do with your respite time. Especially those of us who have limited respite time that we have to use to run errands or deal with other caregiving responsibilities. But if possible, if you can carve out some time that is rejuvenating and restorative for you by allowing you to do the things you once enjoyed doing, like a hobby or visiting with friends or tending to other siblings, respite will have the greatest impact for you over the long term. We even have some tools that you can use to help plan your respite time. They're called the Life Course Tools for Respite. And we developed these in collaboration with Missouri's Family to Family program at the University of Missouri, which is now also called the Life Course Nexus. And they've developed a whole range of wonderful tools related to assisting families over the life course. And then the final segue from talking about planning for respite, and Caroline mentioned this also, especially given the devastating wildfires in Southern California that way too many families are experiencing, planning for emergencies is very critical. And I was asked to just share a few resources around planning for and dealing with crisis management. And I hope I'm sure some of this is repetitive for you, but I hope it's helpful. The American Academy of Pediatrics has a wonderful list of resources for children and youth with special healthcare needs on how to develop a written plan, how to put a disaster kit together, how to help children cope during and after a crisis. The second resource, Disaster Preparedness Guide for Caregivers, was developed specifically for caregivers by the Rosalind Carter Institute for Caregivers in consultation with the Federal Emergency Management Agency, or FEMA. And it's very much geared toward the caregiving role and how to deal with a crisis. The Red Cross Disaster Safety for People with Disabilities emphasizes the importance of creating a person support network and sharing with that network a complete assessment of your child's needs, making sure to include the use of medical and adaptive equipment, transportation and mobility aids, medication, whatever special accommodation your child might need, putting it into that comprehensive assessment and having that ready to go can be very, very useful. And then finally, I wanted to make sure you knew about our ARCH fact sheet on emergency respite. And reiterates and highlights the major themes that run through all of these instruction guides that I just mentioned. And that is, do your research in advance and have a workable and detailed plan in place. As for respite, if you can identify safe places and trustworthy individuals that you might need to leave your child with in the event of a crisis, I mean, that's very critical. So it takes some planning in advance. There are so many providers that are not even able to deal with medical complexities, but if you ask them to do it on short notice, that really further limits the number of available providers. So knowing who they might be in advance, providers who can handle your child's medical and behavioral issues, is really critical. Getting them the paperwork they need in advance, getting to know them, having your child get to know them, by using their services when there is no crisis. These are all very important ways to be sure you're ready if an emergency or crisis should arrive. There's a lot more information in this fact sheet, and again, I'll share my slides with all of you, and again, put the links in the chat. And everything that I've talked about today can be found on our very robust website at archrespite.org. And if you just click on at the top where it says Caregivers, you'll have access to everything I talked about today. And then finally, if you really want to immerse yourself in learning more about respite best practices, what else might be available nationally, how to advocate for respite, I invite you to join us at the National Lifespan Respite Conference that will be held in Huntsville, Alabama this coming April. We will have a family caregiver track that'll focus on your respite and caregiver needs. And we also have some really wonderful children's respite providers that are going to be presenting from around the country. In fact, Jonathan Cotter, again, he from the Children's Respite Homes and the National Association of Pediatric Palliative Care, he's going to be providing one of our keynotes. Jonathan also serves as the co-chair of the RAISE Family Caregiving Advisory Council, which is functions out of the Administration for Community Living in the Department of Health and Human Services. And they're the ones responsible. You may have heard about the National Strategy to Support Family Caregivers that was released in 2022. And the RAISE Family Caregiving Council is now working on revising and updating the national strategy. And Jonathan, as co-chair of the council, is instrumental in that effort. So you have a lot to learn for him when he comes in March. And then finally, I hope that you would all feel free to contact Arch at any time if you have a question or need some guidance. And I just want to thank you all again. And if there's time, I'm happy to respond to any questions.
Thank you very much.